So that's all I really have. At this time, I want to introduce our speakers. We have two guests today, and the topic is on advancing agricultural health and safety. And our speakers are from the North Carolina Agromedicine Institute. So they're going to talk about some of their education initiatives, some of their research and outreach, and share about some of the happenings from their center. So our two speakers are Alyssa Ramsey Spence, and she is the Associate Director for the Agromedicine Institute. And she's also an agromedicine extension specialist. And then we're joined by McKayla Robinette, who is the Farm and Ranch Stress Assistance Network Resource Specialist for the North Carolina Agromedicine Institute. So we're happy to have both of them with us today. And at this time, I'm going to turn it over to them. I know they're going to share a little bit more about their background and kind of how they got into those roles as well as they speak. So Alyssa and McKayla, I'll go ahead and pass it off.
Thanks, Philip, and thanks so much for inviting us to be a part of the webinar today. We really appreciate it. Like Philip said, my name is Alyssa Spence. I'm currently the Associate Director of the North Carolina Agromedicine Institute, and we're just really excited to be here today with people from all across the southeastern portion of the U.S. And so we will talk a little bit about our backgrounds, and I'll let my fellow presenter introduce herself in just a minute, but we always like to share a little bit about our backgrounds and why this work is so important to us. I grew up on a family farm in the western part of North Carolina in the mountains in a very small, rural, remote area. And so my father was a first generation farmer. We had a greenhouse operation that first, he actually produced burley tobacco for 2 years before converting over to that greenhouse operation. But my brothers and I were raised on that family farm, and I decided that that wasn't necessarily my calling, but I wanted to support agriculture. And so I went to NC State University and got a degree in agricultural education. And I would later on get 2 more degrees in agricultural education. I love teaching, and that is near and dear to my heart. And so I now live in the eastern part of the state with my husband and my children, and we actually live on his family's farm. We are not actively involved in the operation of the farm, but we do live there. And my children are the 5th generation to grow up in that family home and on that family farm. So I'll turn things over to McKayla.
Like Alyssa said, just very grateful that you guys are having us here this morning to talk about some of the work that we're doing here at the Institute. And just a little bit about my background. Like Alyssa, I also grew up on a family farming operation. I come from a different perspective in the sense that our operation was recognized as a century farm in 2019. So we have documentation that our farm has been in my family and in production for over 100 years. And so that was really special because not only did I grow up being able to recognize, what my own family, what my parents were doing and their journeys and becoming farmers, but also stories of what my granddad and his dad and going back, what they were doing on the farm and all of those changes. And so I come at agromedicine from the perspective of being able to implement programs and provide supports in ways that I saw my own family needed, and ways that I see my friends that are starting their farming operations in ways that they need. And so it's really special to be able to have this perspective and being able to do the work that I do with the Institute, which we'll talk about later today.
And so whenever we were invited to share some of our insights, I think one of the lessons that has just been a common thread throughout the entire existence of the North Carolina Agromedicine Institute is partnership. And I hope that this conversation is a familiar one for the people on today's webinar, because it's certainly hard to get anything done in this space without working in partnership. And so today, we'll work through some of our lessons learned and some of our tips working with partnerships that are created and then sustained for many years. And so I think an important piece to understand for our perspective is exactly how the North Carolina Agromedicine Institute came to be. We'll look at how our organizational structure is set up to really support partnership across different universities, but also with community partners. And then we'll talk about some of the tips that we have to share. And then we'll talk about the importance of staying out of the silo as we conclude. And then we're happy to answer any questions that might pop up for those on the call today. So to get us started, we are going to have a history lesson, so to speak. And so for me, I think it's really important to understand where we came from and to talk about that origin story. The Institute was formally established in 1999, so we are celebrating our 25th anniversary this year, but we had people in North Carolina long before then working in this space. And so in the late 80s, we had people from North Carolina Cooperative Extension, people working within the toxicology program at NC State, and then also physicians at ECU in family medicine that were really thinking about putting together an agromedicine program and forming that after a model that was currently the only model in the country at that time in South Carolina. And so they were working with people at Clemson, and then eventually we started to shift toward a model in Iowa. But once we put those together, we were formally established in 1999. And so on the screen here, you see the center named as the Southern Coastal Agromedicine Center. And I think it's interesting that we actually started out as a NIOSH funded center. And so you can see the very first institute director there, Suzanne Jetski, who brought in an immense background in working in partnerships with her background working with the Eastern Area Health Education Center and different programs within telemedicine. And she really had a passion for rural health. And so right out of the gate in 2001, through the network of partners that she brought in, the Institute was awarded NIOSH funding in the amount of $3 million for 5 years to start that Southern Coastal Agromedicine Center, which at that time was one of 10 U.S. agricultural safety and health centers for research, prevention, intervention, and education and outreach. And so in addition to those funds brought in by Dr. Jetski, Dr. Cope, who is someone who is near and dear to my heart, he actually led a collaborative research proposal that was funded by the USDA for $1 million over 4 years. And so we had this funding, but then in 2001, we actually got, Dr. Thomas Feldbush helped us, actually found us a place to be headquartered. And so this picture at the bottom of the screen is the office that we're currently sitting in. And it's a really neat building. It was an old Voices of America building. And so it was actually used for radio broadcasting during the Cold War. And so we have a lot of neat things about our building, from extremely thick walls. Our classroom had a false floor in it at one time. And so my director can actually tell you a lot more of those stories. So if you ever run across Robin Tudor Markham, ask her about all the fun things in our building. And so it was Suzanne and Dr. Cope and others working at ECU, NC State, and NC State University, who really came together to partner to establish the North Carolina Agromedicine Institute. And so in 1999, permission was granted by the North Carolina Board of Governors to formally establish the North Carolina Agromedicine Institute. And so we see our state's 2 land-grant universities, which makes sense because we're working with those agricultural populations, and then the medical expertise being brought in from ECU, and those organizations partnering together along with other community agencies and stakeholders within the agricultural community and within rural health and public health. And so that allows us to set up for a fairly unique organizational structure that we'll look to in just a second. But within this organization, across those 3 partner universities, because we are an interinstitutional institute, I love trying to get people to say that 5 times fast. But we have from these partner universities our board of directors, which includes 3 different representatives from those universities, in addition to state agency partners. And then we also, from this, had a board of collaborators, which was more based on some of those industry representatives, which would later be called our board of partners. So from this sort of top of the structure, we have our current organizational structure. And so you see those partner universities set up at the top. Our board of directors, which is who our institute director answers to. And then we also have campus coordinators at each one of the partner universities. So we have someone on campus at NCANT. We have someone on campus at NCSU that's working closely with the institute director and with me as the associate director to really coordinate activities across those partner universities. And then we see here how we're bringing in that board of partners, which is made up of those industry folks and some other state agencies, to really be representative of what we see boots on the ground in North Carolina. And then as we work our way down that organizational chart, we see our project staff, and we see sort of the note there that these do change with the projects that we have in place. The Institute receives a combination of state funds, as well as grant funds and donations. And so these things change in tandem with sort of what our partners are telling us that they need, and so we're reflexive to what we see in the communities. And so through that model and through that organizational structure, you know, we have transitioned away from that NIOSH funding to some of those other funds that I talked about, so that we could really make sure that we're looking at that entire model of research, education, outreach, and prevention and intervention. And so we focus on farmers, farm workers, foresters, fishermen, and their families in North Carolina. We do still work regionally by request, but we really wanted to bring it back and focus on what we have here in North Carolina, from the mountains to the coast. And we are very blessed to be diverse in terms of land and commodities, as well as people. And so we have more than enough work to keep us busy. And so the challenge for us that we, look to every day is translating research to practice in a way that is practical and accessible to the populations that we serve. So we engage those agricultural stakeholders, as well as build on research findings to develop and implement programs for intervention, education, and outreach projects. And here's just a couple of those projects that we have, and I'll let McKayla tell you about some of those.
Yeah, so really a lot of these projects stem from meeting the needs of our community members. And so I'll just give you the bird's eye view of kind of what's happening within each of these programs. And so a lot of what we focus on at the Agromedicine Institute historically was the physical health and safety of our farmers, farm workers, and family members. And so with that, we do have a lot of programs that focus on how we can enhance those qualities within our farmers. And so one of those programs being our Fit to Farm program. So with that, we do have agromedicine nurses on staff that can come out to a farm and take blood pressures, do vision and auditory tests, as well as other basic health screenings for our farmers that might not necessarily have a connection to a primary care physician or have the ability to go to those doctor appointments regularly. So we can actually come out to the farm and handle those, not just for the farmers, but also for their workers. And so in addition to that, as kind of an offset of that, our Certified Safe Farm program is making sure that our farmers are recognizing that their they need to be physically healthy in order to keep their farms healthy. And so our Certified Safe Farm is another program that acts as an incentive for our farmers to be able to say, you know, we are recognized as being a certified safe farm because not only are we able to take good care of our crops and of our livestock, but we're taking good care of ourselves. With that, as another program under that is North Carolina Agromedicine. You probably have heard of Agromedicine. There's an Agromedicine in most every state, but essentially they help farmers with disabilities be able to make those adaptations needed for them to farm in a way that's conducive to them and their needs. So some of the examples of this would be installing lifts on tractors, so to be able to get them into the equipment. We've worked with Agromedicine folks that have installed flashing smoke alarms instead of the ones that beep, so that way, you know, if there's a vision or an auditory concern, they can still see if a smoke detector is going off. And other, you know, other disability accommodations on a farm. We also at the Agromedicine Institute recognize that agritourism has become a huge population or a huge boon as a way to increase and diversify the amount of income on a farm. But that's scary whenever you're inviting strangers onto your operation where, you know, it is a working farm and there are dangers that come with that the public might not be aware of. So we can come out to the farm and help the farmers build safety plans and also mitigate any of those risks that might come up whenever they are bringing children and school groups and visitors onto their operation. Other programs that we include, we do trainings not just for our farmers, but for our first responders. And so that looks like our first on scene and our grain bin rescue training. So, you know, anytime an accident happens on a farm, there's risks that are going to be associated with that our first responders might not be aware of or might not know how to navigate. So first on scene and our grain bin rescue trainings helps prepare our first responders to navigate those issues. And then we'll talk about it a little bit more later on, but our Farm Ranch Stress Assistance Network has also been a huge portion of the work that we've been doing here at the Agromedicine Institute over the past several years. And so with that, I'll turn it back over to Alyssa.
And as we look at some of these programs that McKayla has described, I think it's evident that we try to, you know, to look at the whole farm and approach things from a whole farm perspective. That yes, it's important that we protect the farmer and the farm workers, but also make sure that the farm itself is operating well, and whether that's, you know, financially or with some of those physical hazards and things like that. So we do try very hard to look at everything from a top-down approach, but then to also look at things from an individual perspective as we're working with our farmers and other partners. One of the things that we always try to reiterate is that as soon as we step on a farm, I might have, you know, farm safety expert in my title, but on that farm, they're the expert, and it's important that we listen more than we speak. And really take time to get to know that farm and that farm family and all the workers there before we really start to put together any sort of recommendations for them. And so we're able to offer these programs through partnerships. If you were looking at our organizational structure, you probably noticed that, you know, we have, give or take, about 7 people on staff. And so with those different partnerships, we're able to amplify what we're able to offer and that impact that we're able to make. And so when we were forming the Institute, these were some of our early partnerships. You know, we've got everyone from state agencies to other agricultural safety and health centers. And it's important that, you know, as we have continued to grow, you know, we still work in close partnership with the people that are on the screen. So the people that helped us get started are also the people who have helped us grow and continue to be in our corner. And so now, I'm leaving people off on this screen, but these are some of those other groups that we work with. Again, we see lots of different state agencies, we see grant funders, we see advocacy groups on here, we see farm lenders, and just a diverse group of people who all touch agriculture somehow. And so there's a couple of ways that we try to involve people, whether they be from an industry background or maybe they're in academia. And so one of those programs that we have is called our affiliate member program, or our institute member program. And so that's a program that actually recruits or involves faculty level or other type of people interested in research, and it gives them an unpaid but an appointment through Eastern Carolina University, and they can continue to pursue those research interests in agricultural safety and health collaboratively, and it connects them to a network that we have of other institute members, and so that gives them, access to things like the ECU library, and different things like that to help them with those research interests. But this could be someone who, again, is from one of our partner universities at East Carolina University, NC State University, or NC State University, or it may be a public university like UNC Chapel Hill or Duke, or it may be other researchers who are also practitioners in the field. And so anyone with an active interest can actually apply to be an institute member, and there is a process that goes along with it. We actually have to do a background check and things like that. But once they're in that membership program, regardless whether their interests change over time, we really like to continue to engage them in agriculture, because agriculture does touch all of our lives, and we never know when we may need to call on their expertise to address a certain concern. And so they help shape our mission and our strategic goals throughout the year. So if research is not necessarily someone's lane, then we also have what we call our board of partners. And so our board of partners is, like I've previously mentioned, you may be interested in collaborative research, or you may be someone who's actively involved in education and outreach work, or someone who's involved in helping with intervention. And so that opens up the door to a wider audience. And so our institute members are also our institute partners. And so we engage them not only with people that are in academia, but also people that are in the field. And we think that being that bridge is extremely important, and is one of those things that has helped us grow partnerships and foster collaboration and conversation from a lot of different groups that we have here in North Carolina. And so from working with these different programs and from working in this space, we have just a few tips that we'd like to share. And that first tip is, if you need to share space with your partners, whether that's virtually or physically sharing space, it's really important that you find time to be together. And that time doesn't always need to be when you need something. It's important to come together and to fellowship, whether it's a meeting that they've invited you to, or vice versa. Don't always just go whenever you need something or whenever you're on the agenda. Participate actively and share space with them. We recently, I told you earlier that we're celebrating our 25th year as the North Carolina Agromedicine Institute. And so in March, we actually had a symposium, and on the screen there, you can see all of the different sort of groups or people that participated in that symposium. And so we had people from within North Carolina, from outside of North Carolina. We had people from USDA, NCDA, NCDHHS, the Farm Worker Health Program here in North Carolina, We had people who, had medical backgrounds. We had people with agricultural backgrounds. We had people who were actively interested in helping the needs of farmers as well as farm workers. We had people from insurance agencies. We had those ag lenders with us. We really tried to bring everyone to the table to help us celebrate partnership and to really symbolize what it means to be the North Carolina Agromedicine Institute. And so the picture on the screen there are two deans from our land grant universities who have, participated as institute members or on our board of directors, but coming together. And I think they're a shining example of what it means to be partnership and to have all those people in the same space for a common goal. And so really sharing that space in meaningful ways. And, I think if you want good partners, you have to be a good partner. And so be there in that space and show up for people. The second tip that we have to share is, earlier I mentioned that, we're able to be a bridge and connect different groups. And I think it's really important to connect those pieces. And so on the screen is actually an example of a response that was organized through the Institute and through some of those partners that you see on the screen to provide, to answer some of the needs that arose during COVID for farm workers in North Carolina. And so this is actually a published article. You can read more about this example online, but we called it Working Along the Continuum. And so through this effort, we were really trying to meet the challenges that we saw with migrant laborers during the COVID-19 pandemic. So things associated with migrant worker health, community housing. And so the members that we brought to the table to work on that together was the North Carolina Department of Labor, their Agricultural Safety and Health Bureau, the North Carolina Department of Health and Human Sciences, Health and Human Services, their communicable disease branch, as well as the NC Farm Worker Health Program, the NC Community Health Center Association, and then others like North Carolina Cooperative Extension, North Carolina Department of Agriculture and Consumer Services, North Carolina Farm Bureau, the NC Agribusiness Bureau, and that list goes on. And so this group looked collectively and worked together to look at issues like personal protective equipment, internet connectivity, congregate activities, how those workers were able to communicate with people back home through things like WhatsApp, or with healthcare providers with telemedicine, and then, what to do in instances where quarantine was needed, or to look at testing and contact tracing barriers, and just a whole gamut of different things that impacted this special risk population. And so it really took us working outside the silo to answer that need. There was no way that we could have done that on our own, and we really had to be a bridge that connected the different pieces of people's expertise and what they were able to leverage to answer that need. And then the third and final tip that we have is to branch out. Whenever you work with partners, you have the ability to, again, by connecting those pieces, you have the ability to do more without additional personnel, without additional funding. And that's something that has been really important to us. So on the screen here, what we have, and you're about to hear more about the North Carolina Farm and Ranch and Stress Assistance Network in just a second. But this is a draft of how we have tried to map all of the programs, resources, and services available through this program. And so I know you can't see them very clearly, but you can see that there are lots of things we're able to offer through this network. And then if you look really closely, you can see that the green font and the black font indicates exactly what we're able to offer internally and then through our partner organizations. And so I think the North Carolina Farm and Ranch Trust Assistance Network is a shining example of what can happen and what's possible whenever you're able to create and sustain meaningful partnerships. And so I will turn this over to McKayla to tell you more about that network.
Thanks, Alyssa. So as we mentioned earlier, or as Alyssa just said, you know, a lot of what happens within FARSAN, Farm and Ranch Trust Assistance Network, truly is a testament to the power of the people and who you know and what you can accomplish whenever everybody has a common goal. And so kind of the history of FARSAN. So we established the Institute in 1999, and, you know, we were doing a lot of these physical health and safety programs. And, you know, we were having conversations with our farmers about, you know, look how great it is what we're doing with these physical health and safeties, and, you know, look at everything that we're able to do for you. And we actually had a farmer reach out to us and tell us, you know, it's not going to mean anything unless you address the underlying stress of what our farmers are going through. You know, North Carolina agriculture contributes over $103 billion to our economy, but it also has one of the highest fatality rates across the occupations in our state. And so, you know, knowing that our farmers are giving so much to our state's economy and our infrastructure, but, you know, they are still under a lot of stress and have a lot of concerns that need to be addressed in order for them to feel comfortable in moving forward. And so with that, we established what was originally called Tape and Twine, and then later rebranded as the Farm and Ranch Trust Assistance Network, to really be able to focus on what is it that our farmers truly need from a mental health perspective and a behavioral health perspective, so that way they can then go on to do and perform on their occupations. And so with that, again, a lot of what our work is done through partnerships. And so we have the North Carolina Farm Helpline, which is a 24/7 crisis and resource line available to our North Carolina agricultural community. So not just our farmers, our loggers, but also their workers and family members. This helpline is, again, you know, we operate it out of the Institute, but we also recognize that 988, which is the National Suicide and Crisis Lifeline, exists. There was also several North Carolina specific crisis lines that exist, and they do their own promotions for those programs. And so, you know, even though we have the helpline, we work really closely with our state's 988 and our other crisis lines here in North Carolina to make sure that they understand the cultural needs of agriculture and make sure that those people that are answering their calls from those organizations can direct the farmers to us and direct them to our resources. And if they need help navigating those conversations with a farmer, they know that we are here to provide that support. Additionally, we have a resource directory we keep here at the Institute. Historically, and the way it's present on our website right now, it is listed as a PDF document where these resources outline anything that a farmer might need, not just from their farm perspective, but also their identities as just a person. So our resource directory includes everything from financial and legal help to medical providers to farm schools, you know, whatever that case may be. I like to think of the resource directory as the first step before a farmer goes to Google. You know, the farmer will know anything on our resource directory has been vetted and is truly able to serve farmers. And then also we have agreements with a lot of those programs to and make sure that even if you can't necessarily afford a financial consultation or a legal consultation or a farm school tuition, that, you know, we can help cover some of those monetary barriers that a farmer might experience. And right now we have two resource directories. The main directory has, I think, over 200 resources last I looked at it. And we're also vamping our directory specifically for veteran farmers here in North Carolina. And last I checked, that directory has over 300 resources. So truly just a way that our farmers can get the information they need without the Google info dump that comes with that search. Additionally, we do a lot of trainings here at the Institute. And again, going back to the partnership piece, a lot of these trainings are to make sure that our partners understands the needs of the agriculture community and knows how to have those conversations around mental health with them. And so we do general management of farm stress trainings, not just to our farmers, but also our farm supporters. So our farm credit associations, our farm bureau associations, our commodity groups, things of that. And then also we provide trainings and certifications in adult mental health first aid, youth mental health first aid, question, persuade, refer, assist, talk saves lives, in addition to some other ones. And so all of those trainings are offered on a regular basis in a way that is accessible to our farming community. So we do make concessions for virtual learning. We try to be very flexible. We understand that if the weather is nice, the farmer needs to be out on the tractor. And so we'll help make those adjustments as needed. And just to make sure that everybody who wants the training and could benefit from it can access that information. And then also I wanted just to touch base. I talked a little bit about the financial and legal consultations, but I again want to touch base on kind of the ways that we provide that behavioral health support to our farmers. So as I'm sure most of us are familiar with, there is a stigma surrounding mental health within our rural communities and within our agricultural population, whether that be generational, we're just going to rub some dirt in it and we're not going to talk about our feelings, to, I don't want to be perceived as weak, a masculinity thing, whatever that stigma is rooted in. We want to find ways to meet people where they're at to provide that support. So we provide behavioral health services in 2 different ways. And again, going back to our partnership piece. So we have funds to provide behavioral health care services to anybody in agriculture at no cost to them. And so again, recognizing that barrier of insurance or having disposable income to pay for services. And we do that in conjunction with a provider network here in North Carolina called CareNet Counseling. They have offices all across the state, as well as the ability to do virtual services. And if we have a farmer call our farm helpline or text our farm helpline and say, hey, I'm interested in receiving counseling, we will then connect them to a CareNet counselor. And typically that process is within 48 hours of them calling, they're connected to a counselor. And I've had reports of people that have taken their counseling appointments from the tractor. Some of our therapists are willing to go to the farm and have that session at their kitchen table. And so again, really meeting those farmers where they're at to provide that support. Now, and again, we do recognize that the stigma around formal medical care is concerning for some of our farmers. So we work really hard to develop peer support programs in our state. And so these peer support programs are truly dependent on the farmers within that community to take that charge on for themselves. And so some of our peer support programs, we have a mentor-mentee program called Farmer to Farmer, where we will train somebody how to mentor the farmers in their community. And we can do a formal match here through the Institute, where if someone says they're looking for a mentor, we will match that person with someone. But then also those mentors are just available within that community. And if they're at the feed store or at the diner, having lunch, like they can have those conversations with the other members of their community. Other peer support programs include our Women in Agriculture program. So again, providing an outlet for the women on our farms, not just as farm wives, but as owners and operators to share their unique stressors. And then we have a veteran peer support program running as well. So again, the veteran population in North Carolina is huge. And it's been well promoted for veterans exiting the service to start farms. And then whenever they start a farm, they realize, oh, it's not the sunshine and rainbows that their vocational rehab person made it out to be, and now they don't know what to do. And so we do have veteran peer supporters available to help have those conversations with our farmer veterans as well. And so all of that to say, you know, we truly are here to meet the needs of our community members in a way that makes the most sense to them. And we take a lot of that feedback and work to, you know, make sure that that feedback is addressed in a way that makes most sense for the farmer. In addition to, so that was things that's operating on a state level, but we also work really closely with other states as well through the region or through the National Farm and Ranch Stress Assistance Network. And so an example of this partnership across regions is there is 2 counselors in one's in Minnesota and one is in Illinois that we work really closely with. So as of right now, and this is something that we're working on developing based on need, we don't have a grief support group for farmers in North Carolina. This is something, again, that we're working to address. But in that meantime, there's a group that operates again through the counselor in Minnesota for survivors of suicide. And then there's a group in Illinois that is a general grief support group for agriculture. And so both of those counselors have so graciously agreed that if we have any farmers in North Carolina that want those services, they can attend those services virtually and receive the help they need as we build the program here in our state. And so that's just one example of the ways that we do that. But I could list dozens, and we don't have the time for that. So if you have any questions about the Farm and Ranch Stress Assistance Network or want a little bit more detailed view of that, feel free to go to our website. Feel free to call the farm helpline. I'm normally the one that's answering the phone. I think right now our director has the phone. So you would either talk to one of us and we'd be happy to talk about ways that we can collaborate with you to serve our farmers and our farm community. Alyssa, I'll turn it back to you.
Thanks, McKayla. And so we hope that the takeaway from, you know, looking at how the Institute was made to looking at some of those tips and the examples that we have to looking at, you know, the Farm and Ranch Stress Assistance Network, which I think is a really shining example of what can be accomplished through partnership that is constantly growing. You know, we're constantly having to update that map. It's hard to keep up with all of the partnerships and all the collaborations and everything that is made available to our farming populations here in North Carolina and other places through that program alone. And so I hope that the takeaway is, you know, don't work in a silo. You know, if you're familiar with ag safety, you're probably familiar with the fact that working in a silo is a confined space, and it's even dangerous. And so I think it's important for us to take that lesson and apply it to the work that we do. You know, whenever we're working in that silo and not reaching out to others and not sharing, you know, what we're working on or looking for those collaborations, we're probably not working as effectively as we can, and we're probably not meeting as many needs as we possibly could. So it's really important to make sure that you stay working outside that silo and you're continuing to reach out to partners and to grow your partnerships internally and externally. And so that really concludes our presentation for today. Again, thank you to the Southeastern Coastal Center for hosting us. If you have any follow-up questions that we don't get to in the Q&A or that you don't want to ask to the group, here is our contact information. That is my personal email there at the bottom of the screen. Please feel free to scan those QR codes and follow us on social media where you can see information about events and different things that we like to highlight through that avenue. So questions or concerns?
Yes, and Alyssa, I did just want to first chime in. You're not sharing anything right now, so if there is if you wanted to put your contact information up there or the
I'm
QR
about to
codes.
put it back up.
Yeah. Just because I know some of the folks on may want to check it out. But first off, I just want to say to McKayla and Alyssa, thank you so much for sharing a really great presentation. And yeah, just the importance of partnerships and you know, I think just another big takeaway that I had just personally is just what a great resource you are for the farming and agricultural community in North Carolina. As we know, you mentioned going to Google, right? That's you you want to intersect that, right? You don't want people to go to Google. You want those trusted resources out there and credible. So I do want to open it up. To the group. So you can use the Q&A or you can use the chat. Matt, I see you raised your hand. So you can type it in the chat. You can use the Q&A. And if you have any questions, and of course, yeah, there's the information there if you want to scan it or go to any of the websites. But we'll hang on for just a minute and see if there is any input or comments or anything that you'd like to ask. And Sharon, I did see your question about the presentation. This is being recorded, and so we'll be sure to send out a link to the recording afterwards. Everyone who registered will get that as well. So, and we'll put it on the website.
So I see the question is for helping ag employers set up worker health events, like a small health fair. Would you be able to help with that? Yes, that's absolutely something that we can assist with. We would love to be a part of. So if you want to, Matt, you can email Alyssa or I, and we can help get that started for you. Of course. And Matt asked, did we work with the North Carolina Growers Association at all? Yes, we do, very closely with them as well. So one of the partner conversations that we didn't really discuss as much is we are a part of a collaborative of North Carolina farm worker groups that help to address the health and safety of those workers. And so we meet regularly with the Growers Association to meet any concerns. We actually have a meeting set within the next few weeks to talk about the upcoming growing season and some of the help mitigate any concerns that have come up. So yeah, that was a great question.
And the Corn Growers Association was actually one of our initial partners setting up that Farsan NC network as well. And so, yeah.
Matt said, any specific plans for heat stress trainings, or are y'all aware of any programs that would help employers paid for things like shade tent for their workers? Alyssa, do you want to answer that one?
So it is very uncommon that here in North Carolina that we go out on a farm or we're at, you know, a meeting of any type and we don't talk about heat stress. You know, in North Carolina, it is both hot and humid, like most of the southeastern part of the US. And so, no, I'm not aware of any programs that necessarily allow employers to pay specifically for shade tents, but we do have a specialty crop program which allows them to look at safety and health renovations around the farm, and it's a cost share program. And so with a little creative writing, I feel like that could be something that could be included under that program. Of course, that is only for specialty crop producers here in North Carolina, but you know, heat stress is something that is constantly on our mind. And so whether it's our agromedicine nurses, or, I'm talking about, grain rescue or whatever the topic is, somehow heat stress is also inserted into that conversation. Great question, yeah.
And we can do, if there's a need for specific training on heat stress, we can fulfill that very easily here.
Yeah, we offer, CPR and first aid certification trainings here. And so whether we're doing that on the farm or we're going to talk to just for like the regular safety meeting, that is a topic that we get a lot of requests for. And it's certainly something that our researchers here in North Carolina are interested in. So.
Wonderful. Well, if I don't see any other questions coming in, once again, the contact information is there. And of course, other resources from the center. So at this time, let me go ahead and pull back my slides. So first off, I just want to say, Alyssa and McKayla, once again, thank you so much for the great presentation and sharing about all the great work you're doing up in North Carolina, and of course, throughout the Southeast as well. Just a quick update for, our webinar for next month. We're going to be talking about pesticide safety through the Gear Up for Ag program, and specifically a new initiative with 360 videos. So Dr. Opie McCubbins from Mississippi State University is going to be sharing about some new initiatives they've been testing using 360 cameras to give instructions on how to properly put on pesticide safety gear. I don't know a whole lot about it, so I'm going to learn as well. So be sure you can go to our website and sign up there. As always, feel free to reach out to us here at the center. You can reach out to me, and I'll be sending out an email as well with the webinar recording and everything within the next couple days or so. But that's all I have. Alyssa and McKayla, do you have any last things to share before we hop off today?
Just one more thank you. Thanks for including us today.
Great, great. Well, thank you both so much again. And for everyone else, have a great rest of your day. Goodbye.